Well, I know we're recording, but I have had, I've had Karen Martell, and we focused mainly on hormones. So we kind of touched a little bit on thyroid, but no, I haven't had a thyroid person. So you were my first.
All right.
You're the best. Okay, here we go. So, I record a separate intro, so we just jump right into the conversation. But
Yep, sounds good.
all right. I'm here today with Dr. Amie Hornaman. I heard her on, I don't remember what podcast, some random conversation about a year ago, and I started binging her podcast, the Thyroid Fixer podcast, and absolutely love and adore everything she says. I love her passion, and I was really excited that she agreed to be a guest. So welcome, Dr. Amie.
Oh, thanks, Kim. I'm happy to be here.
Yeah, I myself really, I knew what the thyroid sort of was, I think. I just knew it was a gland in the body, and it wasn't until I had my own journey with thyroid and Hashimoto's, didn't even know the term Hashimoto's until I was in that. So my story was what I hear very commonly from, I know the two of us focus a lot on people in perimenopause, menopause transition. That's when it happened with me. So all of a sudden I started to have all these crazy symptoms, and long and short of it, at the end of this, me educating myself and finding out this term Hashimoto's and finally asking to get tested for it, lo and behold, there's my problem. And what I see in so many people that I work with around this time is it happens to a lot of us, and there's a lot of overlapping symptoms. So I want to go there, but I want to first talk about what is the thyroid gland and why is it important?
So the thyroid is the master. It is the controller of your entire body. So it's incredibly important. And we really need to focus on this gland when we're talking about anything going on in the body. So it's the regulator, the controller. It controls our metabolism, our heart rate, our blood pressure, brain function, skin cell turnover, gut motility. I mean, you name it, and it has an effect on the body somewhere. So that's why we really need to make sure that it's working well, or you'll end up having these symptoms, possibly even misdiagnoses of other things going on in the body, or you'll get a Band-Aid medication for that when it really is just the thyroid. When you come back to that master gland, it has that trickle-down effect where, oh, look, I don't have type 2 diabetes. It was my thyroid. I don't need medication to help me poop. It was my thyroid. So it is the master gland.
Yeah. And what are some of the, I've just mentioned hypothyroid and Hashimoto's, but what are some of the more common conditions or disease states that people can experience when there's poor thyroid function?
So that's it, really. I mean, yes, you could get into the Graves' disease / hyperthyroidism, but that's more rare. And we don't see a large percentage of the population being affected with Graves. And even when they are, they end up swinging over to the Hashimoto side because it's all in the autoimmune category. So Graves' disease is autoimmune hyperthyroidism. Hashimoto's is autoimmune hypothyroidism. And many times patients will swing back and forth. Or I'll see people after they've had their thyroid removed or radioactive iodine because of that Graves' disease. Their doctors basically want to kill the thyroid. And then, of course, without that thyroid intact, it's not producing T4 and T3 anymore. That's where we have to actually start treating them because they'll experience hypothyroidism. So in that category, 95% of all hypothyroid cases, so low and slow thyroid function, is Hashimoto's. In that 5% that's non-Hashimoto's, that's where we'll see the thyroid gland just isn't working as well. Maybe radiation, chemotherapy, excessive dieting, eating disorders, even birth control and certain medications can shut down the thyroid function. So the thyroid gland basically just doesn't work well on its own. In all the other cases, it's the immune system attacking the thyroid gland, and that's where we see Hashimoto's.
Got it. Okay. And I've heard that shared so many times that over 90% of people diagnosed with low thyroid function, actually have the autoimmune condition Hashimoto's. So why is it that so many people are on thyroid? Like, I have hypothyroidism. I know the answer really, but can you explain why is it that so many people are really in that autoimmune category but don't even know it?
Well, number one, they don't know it because antibodies will come back as a false negative quite often. And most doctors aren't testing the antibodies on a regular basis. They might test them one time and say, nope, you're good. So there's those two issues. And then there's the issues of optimal versus normal labs. And that we can extend into every single lab there is for thyroid and even into hormones and all the other labs we test too. But when we're looking at that standard lab value range, we have to remember that that range is taken from a group of sick people, where the functional medicine optimal range is taken from groups of people that are fit and healthy and badasses, and those are the people that you want to be and feel like and look like. That's where we get that functional medicine optimal range. Now, for Hashimoto's, in a standard lab, it's actually a very strange range that you'll see. You might see the LabCorp range for TPO antibodies, that's thyroid peroxidase. You might see that marked as less than 34. And you go, wait, what? What is this? So I'm supposed to have less than 34 antibodies. Okay. My argument is, what if you come back with 20 or 25 antibodies? Antibodies are like soldiers, and they're part of your immune system, but they're confused soldiers. They're there to protect you, but they got a little bit confused along the way, and they now believe that your thyroid gland is the enemy, and they go out and attack it. So in conventional medicine, that standard lab value range, you're not going to be diagnosed with Hashimoto's until you have more than 34 antibodies on this particular test. When in reality, my argument again is, if you have 20 soldiers that are going out and beating up your thyroid, why wouldn't we pay attention to that now? Why would we wait until someone builds a full out army and now they have no thyroid function whatsoever? Their thyroid gland is itty bitty and they're suffering like crazy with symptoms when we could have treated them back when they had 20 soldiers. So the functional medicine optimal range for TPO, thyroid peroxidase, and TG antibodies, thyroglobulin, is 0. You want those at 0. So if you go back and look at your labs and you go, wait a minute, I hear her talking, let me pull my labs out. And you look and you see a 5, a 9, a 10, a 20. You have Hashimoto's. Your doctor just didn't tell you that you did.
Yeah. And that was, I heard you say that exact point. Again, I don't remember what podcast, maybe even it was your own, I don't remember, but I had been working really hard to get my antibodies down after I had found out that I had this. And then everything looked really normal. And it was at the under 34 range. And I don't remember what the other one was. But so I took it as a win, like, okay, look what I did. I went from whatever it was, 200 or can't even remember what the number was. And I brought it down, and then now it's in this, quote unquote, medical optimal range. And then I heard you say on the other podcast where you said 0, and I thought, okay, I still have some work to do here. But so
a couple antibodies we got to take care of.
Yeah, but it's still it's an important, because I remember reading another book way back in the day that said, if you have antibodies, you have Hashimoto's. It's not about being at a specific number, as you say. It's the army is starting, so it's there.
Right. Exactly.
Yeah. The other thing with women in particular, being that's the predominant client base that I work with, why is it that women are more likely to be diagnosed with low thyroid and Hashimoto's compared to men?
So it is interesting, the skewing of the data of how many women are affected by Hashimoto's. Number one, we have fluctuating hormones. So the biggest time that any autoimmune disease will turn on, think of it like a light switch. What turns on that light switch? You'll hear from women quite often, it was after I had my baby. It was after my second child. It was during perimenopause, during menopause. Those hormonal shifts that we naturally get as women, that's what often turns